From being better at handling criticism to misconceptions surrounding mental health care. It is Therapy Thursday. Dr. Brenda Lloyd-Jones from the University of Oklahoma is here with her expert advice. Brenda, always great to see you.
Good to see you, Tatum.
Let's jump right in. Our first question today comes from Jeff. Jeff writes, it seems like the stigma for seeking mental health care is declining. I'm considering seeking treatment myself. Do you need a diagnosis to make an appointment for therapy?
Oh, this is such a critical question, and regardless of popular opinion, you do not need a mental health diagnosis to qualify to get therapy. In fact, what we do know is that those who seek therapy often have better outcomes on their personal and professional lives. What we think about is that there are many modalities for therapy. Therapy can take the form of art therapy, nature therapy. We can meet in groups for therapy. We can also meet one-on-one with a therapist. It is critical when thinking about it, though, we get help, and certainly we see a professional for our heart, for our eyes, for even our teeth. Mm-hmm. Why not see a professional for your mind, for your emotions? And we're talking about a holistic health and well-being scenario. And so I think that it's important to think about, even if you haven't had a traumatic experience, mm-hmm. or you have not gone through a family crisis, seeing a therapist to talk about what's on your mind when you may not want to speak with family or friends. Yes. It could be private, or you may want a more objective kind of interaction. Then a therapist certainly is a viable option.
You know, you often hear that the hardest hurdle, the biggest hurdle when it comes to therapy is picking up the phone and making that decision for yourself.
Yes, absolutely. And what better time to do it when you are not in crisis? So you can go in and you can get a good perspective of what the experience is like, number one, and two, what kinds of coping mechanisms are available, what kinds of interventions may be useful for your particular situation. So yes, going in and making it a regular visit certainly is a viable option.
Yeah, it is. That's good advice. Here's our second question. This comes from Jessica. She says, I tend to respond defensively to criticism about my job performance. I'm very passionate about my work and want to contribute to the team. What can I do to react differently?
Oh, this is another meaningful question. I want to go so many places on this question. But what does acting defensively mean or look like? It is rushing to defend yourself before the conversation has ceased. And that is something that Jessica is not alone on. Matter of fact, what we do know, according to research, defensiveness is a psychological mechanism that is triggered when we are uncomfortable by emotional stressors. And so it is almost, we do it unconsciously, sometimes we do it consciously. But one way to think about it is that under all circumstances, we want to remain calm and respectful. Passion shows up differently for people. You know, when we're at home, we might talk with our hands, we might elevate our voices, we might even talk over one another. But in a professional setting, it is advantageous to mirror the person who's speaking with you. And so if they are speaking in a measured tone, then you want to maintain that. Here's what Jessica can do. She can listen without interrupting, wait until the feedback has been fully delivered, then ask questions. Does she need clarification on a particular area? This is a key question. Ask the supervisor, how would you have handled that particular issue?
Good advice, yeah.
What would you have done differently? And this way, you know what success looks like for your manager, and consequently can begin either modeling it or working it into your own ways of doing your work.
Yes, there's always the learning curve.
Yes.
That's okay.
Yes, it is. Learning and developing, that's what feedback is about. Yep. Growth, professional growth is what you're after.
Yes, Dr. Brenda Lloyd-Jones, thanks for being here this afternoon. We'll be right back.